G'day and welcome. Thank you very much for joining us tonight, and from the comfort and safety of your own home. Tonight we're going to go through what's happened in the financial markets and the effects on investments and what we're doing in terms of our portfolios and what we're recommending people to do, but also look at how share market crashes have looked in the past. I know this feels very different. It feels very different for me compared to the GFC or the tech wreck. So we'll go through and have a look at what has happened in the past, and I can guarantee that each time it feels very different. So what we'll do is we'll just kick off the night. And I also welcome that David Wilson is with us as well, and he'll finish off the night for us. So here is our bit of gold at the start, just to really bore you. This is our, I suppose, our general advice disclaimer. We're not providing personal advice to anyone here. It is general by nature, so you cannot rely on this information for yourself. Please seek personal financial advice. So we'll kick it off with, I suppose, having a look at the coronavirus. It's the topic. It's the thing that's affecting the world at the moment, and this is looking back, really the last month worth of confirmed cases of coronavirus or COVID-19. So going back to 21st of Feb. And you can see here that China is pretty well flatlined across the top, that they're not really reporting many new cases. They've reached their peak early. Obviously, they were the first phase. They've reached their peak early and have really not reporting many new cases. But that is not the case. And you can see here how steep Europe, including Italy, of course, which has been the hardest hit, northern Italy. That's part of Europe, and obviously the rest of the world, which is looking at the US and the like. So there is still a bit of a steep phase there, and it's pretty well illustrated here where China was obviously stage 1, Europe, obviously that's when we're looking at Greece and Italy is a large part of the green there. But you can see here that's starting to stabilise a bit, so it's getting over a bit of a corner. The worry now is what happens with the US, and are they doing enough? So stage 3 looks like it'll be the US, and what's going to, are they going to have a strong spike before they implement their regulations and changes in what they do to stop the spread of the virus, and that's all about giving time for health services to look after people. They can't look after everyone at once. In terms of the death rate, very morbid, so I apologise for that. Obviously, Italy, very high on the left, extremely high mortality rate, about 9.5%. They're saying that the amount of people in obviously northern Italy it's an older demographic, and that's having a substantial effect. And of course, they can only look after so many people. Here in Australia, obviously we're very fortunate. We have a very low mortality rate at this stage, and hopefully going well, everything that's been done to bring it, pull back the rate of confirmed deaths and the cases themselves, that can stay low or going well. So what's the impact on the global economy been? Well, I think this chart illustrates it perfectly. So from the peaks that we only saw 6 weeks ago, I've gone from doing reviews and feeling very comfortable about what's happened with the markets and how well things have gone, but also warning people, as I've done for the last 3 years, warning people that there was always a correction or a crash just ahead of us. What we don't know is obviously how bad a correction or crash could be, and this is more than what I expected. Also, for those that have joined us, thanks very much for coming. On the right hand side, on the plane there of your screen, you can see that you can put in a question, so please feel free to do so. So you can get a question either from myself or Dr. David Wilson as well. So very extreme declines and in such a short time frame, and that's how share markets work. We can you go up with the escalator or go up in the stairs nice and gradually, but when it hits the fan, goes down with the elevator straight down. So this is really no more than 5 or 6 weeks, and Australia only a couple of days ago was negative 37% from its peak, and you can see that's the same in Canada, Europe, US, all very similar. So that's obviously affected people's superannuation balances, portfolios and the like. So what else has happened? Well, central banks, so the RBA in Australia have, they've lowered interest rates. So we're now sitting at 0.25%. It's a new, fresh record, never been to these levels ever. Doesn't matter what demographic you talk to, your 90-year-old father, grandfather, they've never seen interest rates like these. And we were lowering interest rates prior to coronavirus because our economy was not in great shape, and they wanted to make sure that they keep the wheels turning. So the governments and their banks have lowered their official interest rates to help strengthen the economy, to encourage borrowing, to encourage people to go out and spend. And over 100 countries have all just keep an eye on that. Thanks, Reg. It's all right. So travel ban, I'm not sure how long I was muted for, but 100 countries. This just obviously cripples the travel industry, airlines, you name it, restaurants. It's really hurting at the moment. And in terms of restaurants, compared to this time, same day last year, this was restaurant bookings in quite a few countries, essentially down 80% or more, and in Canada it's nearly a full 100%. So we think about the jobs that are gone, that we're seeing in our community, and it's not a slow grind, it's instantaneous. It's really dreadful, and this is where I feel it's extremely different to the GFC. The GFC was a balance sheet issue, very much at government levels and the big corporates, but everyone kept their jobs. China stimulated their economy, and everyone kept their jobs. In fact, the resources boom made sure that labour was really in short supply, so there was jobs for everyone. This is very different. We're now not only having the markets come down severely, we're now having people laid off work with debt, loans, commitments. It's a huge change. Of course, overlaid all of that is what we're doing differently is in a community and as families that we've got to obviously clearly self-isolate to stop the spread. Car sales in China down 92% for the first 2 weeks of Feb. So these are really severe contractions. And when we have a look at pollution and look at nitrogen dioxide levels across China, so you can see here Shanghai and Beijing, really only 1 month later, one month later, a lot of the pollution is now gone, and that's because they've shut down many of their factories. They're starting to get that going again, so all going well that that will start to get going, not from a pollution point of view, but also from a global trade point of view, because obviously there's a lot of items, a lot of assets that has not been shipped out, whether that's furniture or iPhones or whatever it is. Large bulk of it is made in China. So I suppose there is a silver lining for the globe, and what has been really well reported is the canals in Venice. So there's they're beautiful and clear, where previously they're obviously quite muddy. You can't see through to the bottom, but now you can see fish and animals coming back into the city. So quite interesting. And oil, obviously we had a bit of a twin shock. Oil collapsed in terms of its pricing, and that's obviously had a substantial effect as well. So we've been hit at so many different angles. So let's go and have a look at crashes and corrections, but mostly look at the crashes and see what history can teach us. So this is going all the way back into the 20s. Obviously, the Great Depression was down 83.4%. It took just under 3 years to get to that level, and it took 151 months to get back to recovery to where it was prior to the peak. But you can see here a lot of the crashes quite severe, 20%, 10, 15, 22, 15. And obviously right down here, if we have a look at there's the GFC. This is the US market down 50%. The one behind it, which went down for 25 months. That was the tech wreck of 2000. Yeah, through to for us, it felt like just prior to the second Iraq war start, which was the start of March 2003. So, and that was 44% down. You can see the amount of time it takes for these markets to get back. And as a general rule, these crashes are relatively short term when we talk about investment time frame. And we'll touch on that in a little bit in a moment. So let's have a look at Australia and half a century of bear markets. So you can see here that back in the 70s, we had some pretty tough going there. That there was from 70 to November 71, we were down 35%, and it took 22 months. And so on. So you can see the figures here. Again, here's the tech wreck, 51%, not the tech wreck, sorry, the GFC, 51% down. We had 14 months worth of financial pain. Big question marks about what we're going through here, but these events are not unprecedented. They do happen probably once every 10 to 15 years as excesses grow in the economies, and that's why we've been so cautious in the past and warning people that more than likely there'll be a correction or a crash at some stage. I've always said there's always one just around the corner. We just don't know what corner it's going to be. So here it is in February, March of 2020. And I think this is probably one of the most important graphs when we're looking at this. It's looking at what the average crash is, and that's 33%, so a third down from its peak. And then after the low point, 12 months after that low point, what is the average if you hang on? And the average is nearly 24%. Now, if we extend out that 12 months from the recovery, this is some of the figures that we get. That after 1 year, this is back to 53, but you can see here after 3 years in the large cap space, nearly 45%. So these are the things that we've got to be mindful of when we're holding our businesses, our growth assets within our portfolios or our superannuation, is that obviously it'll come down and that will be relatively short term. But if we just hold on strong and then let it grow, the rewards will be there in time. Now, of course, everyone says it feels different. The fear and the pessimism is really heightened. And this is the VIX. It gives you a bit of a feel for the volatility and really how scared people are about investing. So this is the global financial crisis, and we are well above that. As I said, there's quite a few different dynamics: health, coronavirus, obviously flow and effect to jobs, and obviously the markets themselves. So it's understandable that this is higher than what it would have been back in the GFC. GFC affected some people, but it didn't affect everyone. People kept their jobs. So there is a feeling when I talk to my clients, I say, Rob, this is going to be it's going to be about for a long time. It's going to get a lot worse than what it is. And in reality, no one really knows. Everyone's, I suppose, having a guess about what's going to happen. So, but it feels that there's so much negativity that this is the norm. And I can guarantee you that it won't be the norm. In time, this will pass. It will be short term. Whether it's 3 months, 6 months, or 1 year, we don't know. How low the share market may go, we do not know either. But if we look at the past and see what's happened there, these times will come and go, and we will move on, and markets will recover. And when they do, I think they will surprise to the upside of how quickly that can happen. And I think the US overnight, this was Monday night, on the 24th of March, it was up 11% in one night based on the a couple of trillion stimulus package. And we'll go into what the Australian government has done in a moment. So what should we focus on? For me, I think at the moment I've got my head around we need to keep our distance from everyone. And this is some research. I bludgeoned this off the ABC only tonight, that essentially some research from the University of Sydney saying if there's 80% of the population comply with, keeping their distance, staying at home, it's going to make a massive difference. And the curve will turn very quickly. But if only 70% comply, then potentially there's going to be a very steep curve. So this distancing that they were talking about last night, that Prime Minister Morrison was talking about, is absolutely vital. So yeah, I think that's a really important one, and I just thought I'd throw that in there. I'll let David talk more about things that can be done to prevent the spread. The other thing that I think we need to think about is average life expectancy. So for ladies, around 85. For men, we're now over 80. And for people that are, say, just retired, that we, at age 65, at age 65, a lady still has, on average, really 22 and a half years to live. So, a lot of our projections go through into, 90, 93, 95. So your investment time frame, even at age 70 or at age 75, as a couple, I would expect someone's going to be through to age 90. So you've got time on your side, even for those that are well within retirement. You've got to accept the volatility to get a more acceptable return over the long term. So I think that's really important. And then if we look at very much the long term, back to 1970, and you can see here, got the oil crisis, the 87 stock market crash, which was vicious, the dot-com crash, the global financial crisis. These were big drops. These were big news. They were hard going for advisors. And yeah, barring all that, you still had a return of what the market averages over the long term, and that is 5, 10 and 20 years plus of over 10.5%. A bit of that percentage may have shaved off over the last 6 weeks, but still be 10% plus. And yeah, that's the benefit of investing into businesses over the long term. You'll get a tremendous return, but what you've got to put up with is times like right now. But of course, there's a buying opportunity. So then, if we have a look at epidemics across the globe and how it's affected stock markets over the time. So you can see, obviously, HIV/AIDS, plague, SARS, dengue fever, swine flu, MERS, Ebola. There's a lot of things here, but you can see here the market returns. So essentially, the world, for the most part, is reasonably immune. Of course, feels a bit different this time, but over the longer term, recoveries can happen quickly. So when we're looking over a longer time frame, some of the negative returns we see now may smooth out. So what should we be doing? One guy that obviously I think everyone looks up to from a financial sense is Hamish Douglas. So this is one of his quotes. Obviously, expect volatility, but don't panic, would be my view. Yeah, because before 12 months, we'll be looking back at this event and will have passed. And I also look to Warren Buffett. He's been storing cash for probably 3 or 4 years, hasn't been buying much because he knows that markets, in his view, were overvalued, so he wasn't buying. He's been sitting on $128 billion worth of cash, and I've got no doubt over this six-week time frame, he would be absolutely deploying a lot of this money as we speak. So we've essentially got 3 choices as investors. Now, whether this is your superannuation fund, your direct share portfolio, or whatever it is, and when you're invested, your worst option, number 1, is you can panic. You can sell at a low point, or in other words, you can sell when the market's cheap. Not our recommendation. The most common option is for people that are mostly invested in the market is to hold steady. You don't sell and you don't buy, and you throw your statements in the bottom drawer. You stop looking online, which is a really healthy thing to do. and you put in the bottom drawer and know that time is on your side. The best option is if you've got free cash flow, or you can reweight your current portfolios from, say, conservative to balance. Yeah, buy. The market is cheap. It's come down substantially. So it's worth having a look at what options you've got. And let's have a look at the valuations. So this is work from Tim Farrelly. He's an economist based out of Sydney. He provides us 10-year forecasts. We've subscribed to for Tim for over a decade. Extremely good at what he does, extremely common sense. So essentially he provides 10-year forecasts of different markets. Now, he's already had to update his March reports once already, and this is the updated one, and we weren't far off having to update it again. Now, you can see here that not long ago we were up around here, and the future expected return for the next 10 years was around 6-7%. And these are a 10-year forecast, but because like myself, Tim has got no idea what happens in the short term. But so we've come down, and as the share market comes down, our future expected return starts to go up. So we're sitting at 5,000 points at the moment. We've been as low as 4,000, 4,500. So if we're buying in these spots here, we would expect to receive a return for the coming 10 years of around 14%. So this is, as the green light says, this is cheap. We can also look at Professor Robert Schiller's from Vail University in the US. This is his CAPE ratio. I've got 3 countries here that we've put on the chart, and that is the US. So this is a high, obviously the higher it goes up, the more expensive the market is. So you can see the CAPE ratio here, the numbers. So the US have come down substantially, and you can see there's Australia in between, and also there's China. So China, when we're looking at this ratio, appears to be quite cheap. So what are we doing? What do we like? What don't we like? We like Google, we like Microsoft, we like businesses that have a monopoly in terms of their products and services. And I know that during these times, as a business, we've got a lot of people working remote. For a small business, we've probably got four in the office, and we've got 5 or 6 out of the office working from home. And we're working purely on Microsoft Office products that are just essential. We couldn't do it without their products. So they're being used more. So that's going to be habit forming. Google, they have 93% of all internet search is through Google, and I think everyone would be alive if they said they hadn't looked up something about coronavirus, the symptoms, what to look for, and so on. So Google's search algorithms are learning all the time. The more searches there are, the better it gets, the better than their competitors they get as well. So strong balance sheets. Google has essentially next to no debt when you add on their $110 billion of cash and short-term investments, and Microsoft have between $50 and $60 billion of cash. They have durable products that will last, and will last for many years to come, and obviously they continue to be used. What we are cautious about, I think the banks from a dividend yield point of view, and for people that know me and work with me, we don't focus on dividends. We focus on quality of businesses. But yeah, we're cautious about the banks. So nothing wrong with having some bank exposure, but there's very high household debt levels in Australia. We are second highest debt in household levels in the world, behind Switzerland. We're about to cop a lot of higher unemployment, the same as the rest of the world, and we've already been in mortgage stress. So in the lowest interest rate environments that we've ever seen, people have been in stress from a paying the bills, paying the mortgage point of view, and that's when we've had close to full employment. So that's a concern, and the banks are holding the baby when it comes to a lot of that debt. Now, interest rates are going to stay low for a long time. This could be 10 years, 20 years. Based on what's happened now, that could extend out even further. And that's based on the high debt to income ratios. So you can see that obviously interest rates now are just plummeting down. And this gives you a bit of a look at mortgage stress. It's still on the internet. If you did a search for ABC, mortgage stress heat map, this is what would come up across Australia. So you could go and select via a postcode. So here you have Ballarat, it's 3350, that they've got nearly 8,500 mortgaged households, and 60% of those are in mortgage stress. That was 2.5 years ago. Things have not improved and they've just deteriorated substantially. So people with investment properties that are negatively geared, where you're having to put money in to keep them going, just become a hell of a lot more risky, as people may be forced to sell homes. Now, thankfully, the government is stepping in. There is certain measures that will really help out, and I'll cover those off in a second. And some of the banks are also helping out and reducing interest rates and pausing payments on different loans. Now, you'll need to check with your own individual bank to work out what they've done for you and for your loan. So let's jump in and have a bit of a look and see what the government's done for individuals. I would really stress that you chat to your accountant around a lot of these types of things, a lot of it particularly for businesses. But for pensioners, they've reduced the deeming rates that were assessed for the income test. For people that have their superannuation pensions, like they did during the GFC, they've reduced the minimum drawdown from your allocated or account-based pension from down by 50%. So someone aged between 55 and 65, as you'd know, you'd need to take out 4% of the balance on the 1st of July each year. That has now been halved, and that is for this financial year that we're in, and also the next year as well. Now, a very important measure, and I think it's absolutely appropriate, there's a temporary early release of superannuation of up to $10,000 in this financial year, and then potentially again in next financial year. There's some criteria on this, which I'll go through in a second, because I think it's a really important one. Early on in the piece, there was the $750 stimulus payment announced 12th of March, and obviously they're going to do that again for people that are on social security benefits. So research more on these. This is just a very brief overview of what we're seeing. Back to the temporary early release of superannuation. So they're essentially saying that, yeah, 10 grand this financial year, $10,000 next financial year. The payment will be completely tax-free and will not impact on any Centrelink or DVA entitlements. And it'll apply, you will be able to apply from mid-April. And that's going to be done through MyGov. So there's no point ringing up the your superannuation fund as yet, because they will direct you to the MyGov. For those who would like a sheet, we've got some general information on this that was released by the government for, so please let us know if you'd like that. So the eligibility requirements, unemployed or eligible to job seeker payments, youth allowance for job seekers, parenting, special benefits, farm household allowance, or from the 1st of Jan this year, been made redundant, or your working hours have reduced by 20% or more. If you're a sole trader, you're self-employed, business suspended, or your turnover has reduced by 20% or more. So unfortunately, there'll be a lot of people that fit under these categories, particularly in terms of working hours, and for the self-employed in terms of the turnover. So how do you apply? It's through MyGov. You'll need to certify eligibility. ATO will obviously issue a determination to the member and notify the fund, and obviously that's the process to go through. So if you need some more information on that, give us a yell. They've also brought in some obviously policy action for businesses. So the instant write-off threshold, where you can claim a deduction on assets that you buy for a business, is jumping from $30,000 to $150,000. Extra depreciation, again, this is more the accountant field, but I wanted to just cover off things. For people that employ apprentices or trainees, there's an extra subsidy up to $100,000 eligible for small business, medium businesses. Again, there's more obviously loans that the government's going to guarantee So there's a hell of a lot of stuff that's happening to make sure that businesses can stay open and or just stay alive long enough to get through this short-term pain. And obviously the airlines and airports are going to get their own stimulus package. And I noticed that Virgin today announced that they had, I think 8,000 staff have been put off out of 10,000. So 80% of their staffing has gone already. Of course, the RBA that we mentioned earlier is, they've cut the interest rates and they've essentially said that, it's going to be for quite some time that we're going to have these low interest rates. And, the governor afterwards mentioned that 3 years is probably something that they'll be thinking about. And the RBA has also launched a quantitative easing program where they're buying back government bonds. This is something that we've heard about over in the UK, in Europe, Japan and the US. Apparently, first time ever for Australia. So what we'll do is we'll obviously, please put your questions in. We'll cover off Q&A at the end, but for now, I'll pass across to David, and Rachel will just flick a switch for us. So thank you for listening to that. Throw your questions up and we'll answer them after David has a chat. Thank you.
So good evening, everybody. It's probably certainly a new thing that we're all dealing with, both on the personal side and on the medical side, and there are very few parallels in past history to help us prepare for what's going on. The most obvious one in recent memory is probably the AIDS epidemic that some of us older people would remember the early phase of that, where it was all unknown, all very frightening, and but at the end of the day, we learnt to deal with that often with very simple changes in behaviour. We always looked for a quick cure for AIDS, HIV in the early days, and it, in realistic terms, did take quite some years before we had suitable treatment, and there's still no effective vaccine for that virus. So our dealings with that really came down to very simple changes in behaviour, and important that everybody followed those changes. And my feeling is that it's going to be very similar with the coronavirus. In simple terms, the fewer people you have contact with, if you avoid people who are potentially sick, you will significantly reduce your chances of getting it. If you perhaps think of a parallel, perhaps in veterinary, the veterinary world, if you think of Hendra virus affecting racehorses, those stables are very quickly shut down. We stop horses going from A to B, and it doesn't go through the rest of the horse population. And so that's a simple way of understanding what we aim to do with the public health measures. The numbers are quite frightening. If you look at that, nearly 500,000 people worldwide infected. In the US, it's escalated dramatically from, say, a month ago when President Trump was suggesting that it wasn't a big deal and it was all to do with the Chinese. They've now got over 50,000 cases and over 6,000 deaths. We're probably lucky in our country because we're an island. I think we have done the right thing by stopping transport in and out as much as possible, and the states looking at quarantining themselves and separating them from the other states. So essentially it's that way of reducing contact with other people, and that simple message, the 4 square meters, keeping away from other people, washing your hands, all that is exceptionally important. But it is going to be tough in the short term. As Rob mentioned, there's a lot of people who will be out of work, if they're not out of work already, or diminished hours or altered working habits over the next few months. If we look at the Spanish flu, which is probably the other thing that we can look at from history, that took 12 months to really disappear from our shores, and there were several waves of that. So after a few months with the Spanish flu, people started to get a bit complacent, and then the cases escalated. So that's something that we have to learn from and make sure that doesn't happen. It's very important that we care for our neighbours. A lot of us will be staying at home, avoiding going to work or forced not to work. There'll be elderly or those less well off than ourselves close by, and we need to develop a network of care and helping people around to make sure that they're all right. There are probably some good things which will come out of this. We'll care for our neighbours more. And when we're at home, we will perhaps have to think of ways to deal with our time that doesn't involve going to the cinema, going to the pub, going down the street. That has a challenge. We have to probably focus on our relationship with the people in the household. We don't want to go stir crazy and kill our partner. But we might take that opportunity to be able to develop a relationship with those closest to us. I think it is important. It's a stressful time, so we do need to look at nature, look at the stars at night, and at least get some comfort that it's not all bad. And I think that this will be something that both from the medical point of view, we will be looking backwards in maybe a year or maybe 2 years, and it will all be past, and we'll be on the other side. In the same way as Rob suggested, that in the same length of time we'll be over this hump financially, and things will be much better. In terms of medical services, there's been a lot of planning going on in the background, both at the local hospital and in our practice. And I think be reassured that the planning has gone on in the background, a lot of it unseen, so that we will continue business as usual. There's some reduction in some services, such as elective surgery. That's all to make way for the potential for sick people if they occur. Essentially prepared for the worst, hoping for the best, so that local services aren't caught out. So I think the simple message is we can't rely on fantastic new drugs. They may be some time away. We're not looking at a cure, and the simple things of social distancing and hygiene are the things that are going to get us through this, but also get us through to the other side. Rob, yeah.
Yep. Thanks, David. We've got a number of questions there that we might get you to have a look at, if that's all right, and they're all directed to you. And I'll just publish the first one. And that is, yeah, David, can you catch corona twice?
The thought is that's probably unlikely, but having said that, the SARS virus from a few years ago, the evidence was that after a few months, people's immunity did wane, so that there was the potential for people to get it a second time after several months. The hope with corona is that we will have eradicated it from our populace, so that the chances of getting it twice would be limited. And we're all holding out for the potential for a vaccine, but still might be 12 to 18 months away to be realistic.
Thanks, David. Another one here, and this is from myself, where what's expected, after the virus has come and gone. We've got obviously vaccines to help protect people. Will this be a virus like we'll have, flu shots each year for at-risk people? Is that what we'll expect in the new world with coronavirus as part of it? Will we build up immunity and obviously vaccines to protect those that need to be protected? What will it look like in the future?
I think, Rob, we don't really know the answer to that question. It's so widespread that it's unlikely that we'll have that sort of Hendra virus analogy where you've only got a small group of horses and stables which are infected. This is a worldwide thing. So we really don't know whether it's going to have a long-term reservoir of infection within the population that goes from Northern Hemisphere to Southern Hemisphere and back again as the seasons go. But hopefully it may well be that we might be able to eradicate it from most populations.
Great, thanks, David. Next one we've got. Please feel free to ask a question. Yeah, when do you think coronavirus will arrive in Horsham?
To my knowledge, there's no proven cases in Horsham at the present time, but as we know, there's increasing numbers in both metropolitan Victoria and the surrounding areas. So I think it's only a matter of time. I wouldn't be surprised if we have a positive case by next week.
Right. David, another question we've got here. How many respiratory machines are available at our local hospitals?
There would be a total of 7 machines, but that also includes the ones that are used in theatre and the emergency department. So the issue that we have at the hospital is that we've still got to maintain services, so that if you have a heart attack or if you have a burst appendix, we're still having to manage that. So some of those machines couldn't be used all the time for coronavirus patients. We'd still need to provide for those surgical emergencies.
Thank you, David. Question just came through is, yeah, do you think the government has done enough in terms of restricting movement and, yeah, just keeping us apart?
Okay, I think time will tell. Probably personally, it would have been nicer if it was done just that little bit earlier, but I guess it's always a movable feast in terms of trying to bring the populace along with us. It's not a totalitarian regime like China, so it's much harder with the Australian psyche to get people to change their habits. I think currently they're doing a good job, and although Daniel Andrews might not be my favourite politician, I've been impressed with the strength of his speeches the last couple of days, and the Prime Minister as well. So I think they're getting on board, and it seems like people are working together.
Great, thank you. Last one, just in terms of our day-to-day movements, David, where people can just stay at home. I know you're an essential worker, that's not something you can do, but for those that have the opportunity to stay at home and work, would you recommend that as the best deterrent that's out there for our local population?
Yeah, it certainly is the best thing to be at home, not go out unless you're absolutely necessary. Perhaps choose your time. Everybody running to the supermarket toe to toe isn't very helpful. I think only buy what you need. Make sure your neighbours have got adequate supplies as well. But I think staying at home is by far the safest thing.
Great, thank you. I've got a question for me. Rob, what's your recommendations for ETFs? Now, ETFs are that's called exchange traded funds. Generally, what we're doing there, using some of the active ETFs. I mentioned earlier, we're keeping things pretty simple. We like MGG, the MGE, that's Magellan's funds. I know they've got large weightings towards the best businesses in the world. That's obviously Google, Microsoft, Facebook, Apple, Visa, MasterCard, just some fantastic businesses there. So there's some of the things that we're looking at, and obviously we're keeping things pretty simple. Another question that we've got is, and again for me, do you think the share price will drop in in line with the increase of COVID-19 deaths and cases. I do think that, yeah, there is clearly a link, a correlation between the two. But as we've seen, some countries, the line starts to flatten out, that the steep increase in cases starts to reduce and the line, it starts to flatten. Then I think you'll be surprised how quickly the market can jump away in those circumstances. But yeah, to a degree, I'm sure that's definitely the case. Just reading the next one, David. So if you think there will be a case in Horsham by next week, then potentially someone could be walking around with the virus at the moment. So practicing social distancing would be very important, ?
I think they've answered their own question.
Yep.
I think it is a case of staying away from people, not getting too close to people, following the rules, and that's the safest way to go. Yep,
fantastic. Very good, David. That looks like that's all we've got. Thank you very much for taking the time, to attend tonight. Really beneficial. Thank you very much for everyone that's the attendees. This is our first webinar. It's a new one for us. Thank you for Olivia and Rachel for helping out with the tech and just making sure we've got things right when something's new. So thank you very much. I think everyone will get the ability to get a recording of this if you've been an attendee. Appreciate the time it's taken, and let's all keep our distance. Just a note about Consortium Private Wealth. I've seen a lot of people, few in the office, but the door is closed. I'm for the most part working from home, and but keep ringing through. If you're nervous about the markets or anything, just ring. We're here. This is when we work harder than ever before, and it's important that if you get nervous, that you definitely get on to us, and we'll help reassure you at the time when you need reassuring most. Thanks very much, and thank you for those that have said thank you, part of the Q&A as well. And we'll see you next time, and give us a bell if you need. Cheers.